In 1947, the world had a cure for syphilis. A simple course of penicillin. Cheap, effective, life-saving. But in one small town in Alabama, hundreds of men never got it. They believed they were getting free medical care from the U.S. government. In truth, they were part of a secret experiment. An experiment designed not to heal them, but to watch them suffer, to watch them die. This is not fiction. This is the true story of the Tuskegee Syphilis Study. A 40-year deception, a betrayal so deep it shook the foundations of medical ethics. Over the next few minutes, you'll hear how a government health program turned into a medical trap, how doctors knowingly withheld a cure, how whistleblowers were ignored for years, and how this crime still affects trust in medicine today. Stay until the end, because the truth is more disturbing than you think. The year was 1932. America was in the grip of the Great Depression. Jobs were scarce. Money was scarce. Medical care was a luxury most could not afford. In rural Macon County, Alabama, poverty was everywhere. Most black families worked as sharecroppers, laboring on land they didn't own. Many could not afford even basic checkups. Syphilis was common. The infection could hide quietly in the body for years, then strike without warning. It could cause blindness, paralysis, heart failure, insanity, and death. At the time, there was no cure. Treatment was harsh, often using toxic mercury compounds, and it didn't always work. That year, the U.S. Public Health Service, working with the Tuskegee Institute, announced a new health program. They claimed it would offer free treatment for bad blood, a term locals use for a variety of illnesses, anemia, fatigue, and syphilis among them. 600 African-American men were enrolled. 399 had syphilis. 201 did not, serving as healthy controls. They were promised free medical exams, free meals on exam days, and burial insurance for men with little. It sounded like a blessing, but this was no ordinary health program. It was a study, officially called the Tuskegee Study of Untreated Syphilis in the Negro Male. The goal? To observe the natural course of untreated syphilis, from infection to death. No one explained the real purpose. No one told the men they had syphilis. No one said that they would be denied treatment, even if one was found. In the 1930s, the deception might have been defended by ignorance. There was no cure. Doctors claimed they were simply studying the disease. But in 1947, everything changed. Penicillin was proven to cure syphilis completely. It became the standard treatment across the United States. The Tuskegee men should have received it immediately. Instead, researchers made a chilling decision. They would not give the drug. They would keep watching the disease kill. Medical staff actively blocked treatment. If a man joined the military and tested positive for syphilis, the Army would offer penicillin. Study staff stepped in, making sure he never got it. If he visited another clinic, they sent letters warning doctors not to interfere. For decades, the men kept returning for their special treatments. These were not treatments at all, just tests, blood draws, spinal taps, physical exams, all designed to measure how far the disease had destroyed them. Year after year, symptoms grew worse. The disease invaded their brains, their hearts, their bones. It took their eyesight. It took their sanity. It took their lives. Some passed the infection to their wives. Some wives passed it to their babies, causing stillbirth deformities and brain damage. By the 1960s, many of the original men were dead. The survivors were frail, disabled, too sick to work. And still, the study continued. If this level of betrayal shocks you, subscribe now and turn on notifications, because what happens next proves that even when the truth was discovered, it was almost buried forever. In 1966, a young venereal disease investigator named Peter Buxton joined the Public Health Service. 3 years into his work, he heard whispers about Tuskegee. He was horrified. He filed an official protest. He argued it was unethical, inhumane. It violated every principle of medicine. The response? Dismissed, ignored. In 1968, he tried again. he was ignored again. By 1972, Buxton realized internal protests would never work. So he took the risk and leaked the story to a reporter at the Associated Press. On July 25, 1972, the headline hit newspapers across America. Syphilis victims in U.S. study went untreated for 40 years. The public was outraged. Politicians demanded answers. Within weeks, the study was shut down. The fallout was swift. A class action lawsuit was filed on behalf of the men, their wives, and their children. In 1974, the U.S. government agreed to a $10 million settlement. Survivors and their families were granted lifetime medical care. That same year, the National Research Act was passed. It required informed consent for research. It created independent review boards to protect human subjects. But the damage could not be undone. By the late 1990s, only a handful of survivors were still alive. One man said, "We were just guinea pigs. I trusted them and they lied to me." On May 16th, 1997, President Bill Clinton stood before the survivors in the White House. He looked them in the eye and said, "What was done cannot be undone, but we can end the silence. We can stop turning our heads away, and I am sorry." Some survivors sat in wheelchairs. Some leaned on canes. They listened as the nation finally acknowledged the truth. The Tuskegee Syphilis Study became one of the most infamous examples of unethical medical research in history. It deepened mistrust, especially among African Americans, towards the healthcare system. That mistrust still affects public health today, from vaccine hesitancy to low participation in clinical trials. But Tuskegee also reshaped research ethics worldwide. It led to the Belmont Report, outlining 3 core principles: respect for persons, beneficence, justice, principles designed to ensure such a study could never happen again. For 40 years, doctors took notes while men lost their eyesight, their sanity, and their lives. They called it science. History calls it crime. The last survivor died in 2004, but the memory remains as both a warning and a demand for justice in every corner of medicine. If you've stayed to the end, thank you. For more true stories of trust betrayed, subscribe and ring the bell, because the truth must never be buried.